So we're going to be watching parts of a film called Medication for Opioid Use Disorder, Learning from People with Lived Experience. Dr. Jane Everett and Rachel Grob, I'm sorry, are joining us from the Qualitative and Health Experiences Research Lab at UW in the Department of Family Medicine. They focus on work about listening to people's experiences related to health, including substance use disorders, and have created this film. I've seen clips in the past, so I'm excited to see more. I believe you guys were interested in sort of ongoing conversation, perhaps even throughout. So, how would you like to do that? Like people write a chat in the, like, should people interrupt the film or what is best?
Yeah, we have a few sort of built-in
Oh,
pauses
great.
that we would
Okay.
love to invite people to come off
Okay.
mute and reflect. Also feel so welcome to add things to the chat anytime.
Okay, so there will be like some pauses and yeah. Okay, great. Well, I'll let you take it away. Thank you for joining us today.
Wonderful. Well, it's such a pleasure to be with you all. We're finding that case so interesting and wanted to keep hearing more, but to hear a little bit from some of the people's experiences with medication for opioid use disorder. Our goal today is really to share a couple of segments of this film. The full film is publicly available online, so also invite people to take a look at it there as well. We have a very brief confidential survey that we invite you to take here, just so we can kind of have a sense of who's in the room and what some of your experiences have been. There's a QR code here. I believe our colleague Emily has also just put the link in the chat. We'll just give people just a few minutes to follow that link. So we're going to be very brief in our background here so we can get to the film, but we are part of the Qualitative and Health Experiences Lab, as mentioned, and we do rigorous qualitative and mixed methods research, really with the goal of making health and healthcare more equitable and person-centered. Just a tiny bit about the methods we use. We have the privilege of connecting with many different people who have all kinds of intersectional identities. And we usually sit down with people for, 2 hours to hear about their health and healthcare experiences, and then synthesize what we learn across different people's stories and try to amplify that to make health and healthcare better. And that's sort of the part we'll be focusing on today with this film, which was created from interviews that were done with 38 people from across the US. You can see just a brief snapshot here of some of the demographic information, things like how long people had used medication for opioid use disorder, people's housing situations, including experiences of having unsteady housing, insurance types. You can see the majority of folks were on Medicaid, and then race and ethnicity. So today we're going to be watching a few sections of the film, starting with people's experiences learning and deciding to start on medication for opioid use disorder option. We'll then have a brief pause for some reflection, and then share a few more segments about people's experiences being on these medications. We'll have a longer discussion after that, but again, feel very welcome to use the chat for any reflections at any time.
The purpose of this film is to spark conversations and establish touchpoints to guide learning or improvement work in a way that is grounded in patient experiences. This film was created from footage of virtual interviews with 38 people across the United States with experience using opioids and seeking medication treatment for opioid use disorder. Their voices and personal experiences differed, but they shared a belief that speaking up and telling their stories would matter. These clips were selected because they represent common patterns. Not everything you hear will be directly relevant to your situation, but each story can spark ideas. Companion materials are available at healthexperiencesUSA.org/catalystfilms. In our study, some people wanted to share their experiences but remain anonymous in this film. At times, you will only see a silhouette or see text on screen along with narration. You'll hear people describe their experiences with opioid use disorder, or OUD. Each person is the expert of their own story of medication for opioid use disorder. You'll hear this referred to as MAT, medication-assisted treatment, or MOUD, medication for opioid use disorder, as terminology continues to evolve. MOUD options people talked about include Suboxone, Methadone, Sublocade, Vivitrol, and Naltrexone. People first learned about MOUD in different ways. They shared how they decided to start MOUD and choose among various medication options.
And I looked it up on Google, and sure enough, there were plenty, and I decided to give it a shot because at that time I had tried to quit multiple times and never worked.
Friends that used that or trying to get clean, they would tell me, "Oh yeah, Suboxone, you withdraw and Suboxone will help you, or Suboxone will help you not think about it."
And I knew that it would probably be a good idea for me because I had such a strong addiction to opioids before I went to prison, and I wasn't sure if I was going to be returning to my hometown or not. I went to my hometown for work release, so they had the option that the people that wanted to, that they were able to go to a health clinic and get on Suboxone.
I had a female probation officer. She was instrumental in the Suboxone. She said, "You can't go back out there. You'll just start using drugs. So I'm giving you a choice, methadone or Suboxone." And I took Suboxone.
I've never really been too big on maintenance drugs. And I actually still feel that way a little bit, but I lean more on the fact of, in reality, I'm not the one with the PhDs here. I may have the PhDs in other aspects of life, but as far as me, remaining clean and living a healthy life, I pretty much don't know how to do that.
My reasonings on why I chose Suboxone, at least over something like methadone, is just, Suboxone is only a partial agonist, whereas, methadone is a full agonist. And, let's say I get up to 150 milligrams of methadone, the tapering off process of that is going to take it's going to take a long time. It's going to be like a year or longer. So I went, the Suboxone route because, it would, help the cravings better than something than just like an antagonist like naltrexone would or Vivitrol.
I wasn't really told anything on the phone other than don't take anything for a certain amount of time before you come in. It would be nice to have a little more information or have something to help you get through the first few hours until you start your medication.
They were going to prescribe me oxycodone or Oxycontin or whatever. And at that point, I just got in a car wreck and because of drugs. And I didn't want another pharmaceutical addiction. So we just had a conversation, and I just decided that it would be better for me. And he was fully supportive of whatever. He was actually like, he's like, "I'm proud of you for choosing Suboxone over Oxycontin."
People shared with us how MOUD feels, including experiences of side effects, and talked about how they accessed MOUD over time. Some people talked about switching the type or dose of MOUD they take for various reasons.
It helps you not think about it. It also helps you just medicate about it. Like if you're having a hard day, take a little bit of your strip and you'll be fine because you're not sitting there thinking about it anymore. It just takes it away. It also helps me with my anxiety because I know, okay, if I have that strip, I know that I won't use because you can't get high off of it. So I know if I take it every day, I won't get high.
I wasn't used to not putting a substance in my body every single day. So I think that the Suboxone was helpful for that. It made me feel more like comfortable in my own skin.
I hate to say it, I feel like it brings it to a bad rap because really without it, I'd probably still be using. It does give you kind of high. It's not quite like regular opiates or heroin or anything like that. It's a little different. It kind of makes you a bit more lethargic, and it definitely does raise your body temperature.
I don't feel it at all, which honestly for me is perfect and totally fine. I don't want to feel like I'm taking medication and then be questioning myself, like, am I taking it because I need it, or am I taking it because I want to feel the warm, fuzzy feeling?
I was having a lot of lasting withdrawal effects even after a week. And the Suboxone took all of that away and, kind of made it better. Whereas Vivitrol, like, even if I could have gotten the shot successfully, I think it doesn't take away, like, withdrawal.
I guess sometimes it kind of kills your motivation. Kind of makes you depressed a little bit, I would say, maybe. Kind of like what heroin does to you a little bit, like kind of kills your drive to do things, you know what I mean? So it's kind of like sometimes you got to force yourself to do things.
Try to quit multiple times and never worked. So I was like, okay, let me try this new drug. Of course I was getting it from the street, but I figured this might help out, and it did for a while. I managed to go do a semester of college, and I was quite productive. But that kind of it gave me hope, but connection kind of ran its course, and she refused to give me any more methadone. She said it was bad for me, as if any other opiates any better for you.
I found out they had a delivery program where they would pick you up, bring you home. And I said, why the fuck didn't you tell me about that? And I got on that, and then it was okay. It was easy because the guy would just show up every morning.
I went on Suboxone through a cash clinic, and I've been on it ever since. I now get it from a regular family physician, which is much better than the cash clinic.
It's Medicaid, which they cover the whole program and the medication. So yeah, that made it really easy. If I hadn't, it would have been very expensive, and I probably wouldn't have been able to do it at all. Because just the medication without insurance, it's like $200, $300 a month.
Me and my partner at the time, we both went down there and got on. And that didn't end up working out for me, that program. But because I'm not accountable, like, to go somewhere every day, otherwise I'd have a job. So then I found out that my regular doctor's office does the Suboxone.
With Suboxone, it's regulated a certain way. So everybody that's prescribing it has to follow certain guidelines with it. But like, I'll only have to go every week, and I can do telehealth. And I'll only have to do a UA like once a month or something like that. So it's a lot better.
I feel like I'm more in control with the Suboxone than the methadone, where you just go there and they give it to you, and it doesn't matter how you feel. It doesn't matter nothing matters. You have to take it because they're giving it. They are in control. And I don't really trust them because, they told me like the pain medicine was going to be all good, and they didn't tell me that 20 years later that I was going to be addicted to pain medicine.
I think it's a little differently now. Before, when I started, I was on a very strict regimen, 8 milligrams in the morning and 8 at night. But what happened was, like I said, I don't like to be on medication so much. What I'll do is I'll cut it in half. If I feel a little bit, on the weak side, you know what? Here's my, my little help that I'm getting through my doctor, and my doctor says it's okay to take this way.
So you're still on the Sublocade, but not on the Suboxone?
Correct.
Yeah. And is it a monthly?
Yes, it is.
Shot.
And I'm happy about that too, because I'm not going to lie. For me, the Suboxone, I was taking it 3 times a day. That was a reminder every time I put that film in my mouth. I'm a heroin addict. I'm a heroin addict. I'm a heroin addict. And, for other people, they might not feel that way, but I did. And I didn't like it. I kind of like the fact that I get that shot and I'm done for the month. I don't have to think about how I'm going to take care physically of that addiction.
I was on Suboxone for like 6 months last year, but I ended up just not taking it because it wasn't doing anything. Like, it wasn't helping me.
With, you know, taking the buprenorphine in the beginning, it wasn't easy. It wasn't like a complete success. I was managing to put a few, months together here and there, but I would always end up going back to the substance.
I've struggled for probably the last, 4 years on enough of the program. Lord, that the doctor lets me come back when I'm ready and puts me back on and lets me, they're really, really awesome doctors. They're willing to keep giving me chances, and I really appreciate that.
So please continue to add any, reflections, reactions, questions you have that you'd like to share to the chat. And we'll just watch a few more minutes, in this case, about people sharing some messages they'd have for clinicians.
I've been to the hospitals, and they're doing awesome stuff. You guys are trying, and for y'all to do this kind of stuff for like people like us who are like down at the bottom of society, and it's pretty cool.
I would just say thank you. I would say thank you. And I would say I appreciate you because you pushed me to go harder. You pushed me to be a better person because, your thoughts and your opinions made me feel maybe less than. But now that I've learned from your thoughts and opinions, I feel like I'm better.
You got to take it easy on your patients, man, because it's harder on the patients than it is on the doctors. The last thing we want to do is hear no, because we're seeking help. And it's hard. It's hard enough for us to ask.
I think healthcare providers could give you a better understanding of the effects of what prescription opioids can do, instead of just a little piece of paper that warns you about it, and that's it.
You can't scare anyone into really getting sober. You can kind of, you can point out, like, if you keep doing this, like, you're probably gonna die, right? But that didn't scare me. Like, I'm like, yeah, but like, am I going to die like today? Because if I'm going to die like next week, then I think I still got a chance, right?
We ask because we need it. If we do ask you and you say no to us, we're going to go and use no matter what. I mean, what do you prefer us to do? Use our medications, or you want us to go overdose and die? I think I'd rather use medicinal than street. I mean, I'd rather know what's inside of my medication than fentanyl and all that stuff.
I think making sure they're educated about, Narcan, make sure they have it, give them access to resources where they don't have to be clean to access them.
Give them the information, give them the advice, just offer it to them, and if they take it, they take it, It may not seem that they're not listening to like what they're saying or the advice and stuff, but it'll be with them, later on in life,
Go off what's written by not only professionals but ex-addicts themselves.
I would tell them just listen, just kind of put yourself in our shoes. I know it's hard to, especially not knowing what it feels like. I would just say be patient.
I'd say maybe build a relationship so get to know more intimate patient.
Like, even though they use drugs, you still need to care for them. They have health problems. They might have health problems because they use drugs, but they did that to themselves. But that's okay. Still help them.
Thank you so much, and keep doing what you're doing. You know what I mean? You're changing lives like mine and many others. There's so many lives out there that you're helping, and you may not feel like it at the point where you're at, but believe me, you are changing the community. step by step, you're changing the entire world.
You know, the biggest thing I think would be to just never give up on that one person. But you know, the frustration that I can only imagine that people have with this addiction, with people relapsing over and over and over again, overdosing over and over and over again, that my doctor even given up on me, I would have given up on me. So it does matter.
This film is dedicated to the participants who shared their stories about medication for opioid use disorder. The film was created by a team of researchers at the Qualitative and Health Experiences Research Lab at the University of Wisconsin-Madison in collaboration with many engaged partners. This film draws on interviews conducted by researchers at Oregon Health and Science University, OCHIN, and the University of Wisconsin-Madison, with special thanks for the partnership of the Protea Lab and Wisconsin Voices for Recovery. We thank the participants in this research for generously sharing their stories and experiences with the goal of helping others.
Beautiful. All right, we have just a few minutes left, everybody. But we wanted to open up some space for you to come on camera or just come off of mute and respond perhaps to some of these questions, maybe starting with just what resonated with you in the film. Did you have strong agreements or disagreements or any questions for us about how we put it together?